Okay, it looks like we're live. I don't know if it's going to Instagram or not. It's sometimes you get stuck.
Mm, yeah,
We'll see. Okay, so you're back home in your home in
yep,
Australia.
yep.
And this time when you went back, you had a little bit shorter of a trip only because you didn't take the train at the end, right?
Yeah, yeah. But the luggage had a longer trip though.
Yeah, the luggage didn't make it, did it? Oh my goodness.
No, no, it didn't make it. We had to pick them up 2 days later at the Aubrey airport.
Mm-hmm.
But they did rush the luggage to us as soon as they could. So it's
Good,
wasn't
good.
really that big a deal. Yeah.
No, that's
They
good.
knew where it was. They knew where everything was, with all the barcodes and stuff that they have these days.
Yeah,
So,
that is
yeah,
good.
yeah,
And what you got home and Angelina left pretty much right away.
yeah, yeah. That one just took off to go and see a friend in Melbourne, like, 2 days later. Yeah, that was
Yeah,
it.
yeah.
So she obviously had no jet lag whatsoever, that one.
No, she told me she didn't. I told her, I said, I gave her all my tricks. I'm like, you already pretend like you're at the places you're going to, and that
Yeah,
helps a little bit. But she also didn't have surgery like you did either.
yeah, yeah. And then plus she, like on the airplane, the long trip, she slept the whole way.
Of
Like,
course she did.
yeah. So yeah, not the same.
No, not the same at all. Well, for those people who don't know, maybe this is the first time for some people tuning in. My name is Candace. This is my friend Nikki. We met in 2018 in March in a women's support group on Facebook. And she got diagnosed out of nowhere with diabetes last June, so June of 23. And then August is when they finally found the reason that you even got diabetes, which you cured in 30 days of nutrition, but you got that because you really had pancreatic cancer, and that was August that you got diagnosed formally, right?
Yeah, that's right.
And started chemo pretty much right away. Finished that up in November. Then January of this year of 24, they opened you up for the Whipple. They took off a couple little lesions on your liver, and then said no Whipple for you, and then closed
Yep,
you back up, and
yep,
said palliative chemo until you're no longer here. And you found out about nanoknife surgery with immunotherapy. Found out one of the best doctors lives just down the street from me, meaning like an almost an hour drive. Reached out, and you and Angelina arrived at the Miami airport on March the 20th after lots and lots of traveling. And we got going, rocking and rolling. You the very next day, we went up and went to the beach and did all the things, and then we started doing all your preoperative stuff that the hospital required. A lot of the things you already had done before in Australia, but different place, different tests were needed again. You did the PET scan and all the fun stuff, and that's where we met. Laura, I should say Laura. How do
law,
you say?
law. Yeah,
Thank you. See, the French in you is helping with pronunciation. Thank you.
yeah.
And
Because she's got a French name, so
she
yeah.
does. She has a very interesting name and a great person. And her and I've been chatting a little bit. I'll keep you updated on her a little bit because she's going to start doing a cold plunge therapy.
Oh,
Also,
okay.
yeah. And anyway, we met her while we were talking to her dog Benny at the Boca Town Center, which Benny's her dog. Yeah, and found out that she had endometriosis cancer 2 years ago, and she herself is a physician, and she was quite inspired by you. Like a lot of people
Hmm.
have been. And you and I did our last Facebook Live to update people right before your surgery on March the 25th. And here it is now, April the 21st for me, April 22nd for you, because you're upside down the other side of the world.
Yeah,
Pretty
that's
much.
right.
Yeah. So let's keep them updated about what's happened. So you had your surgery on the 26th of March. You stayed overnight
Yep,
one night at the hospital.
yep.
They took really good care of you there.
Mm-hmm.
And that's when I got to meet Dr. Donoway for the first time. Was after your surgery. He came out and spoke with me and my husband Michael, and of course your daughter Angelina that was with us after surgery, and let us know how well the surgery went. He also took off a couple more lesions he found on your liver again. Remember that? And
Yeah, yeah.
the tumor itself was vascularly entwined. He also did some scar tissue revision. Thankfully, when he first went to school, he was actually going for be a plastic surgeon. I found out a very specific type of plastic surgeon, craniofacial surgeon for more specifically for congenital child deformities for the face. And then his own father, right, got GI cancer. And that's when he went back to school to learn this specific technique for nanoknife surgery. And he does this type of nanoknife surgery for different types of cancer too. And that's why I think it's so important that we educate people on that, you know. And of course, his facility is Atlas Oncology, in case anybody wants to Google it. But yeah, so you stayed overnight, and then I had to work the next day, so I couldn't come pick you up, but Michael and Angelina did. And I think that was after they went and had a burger or something. Knowing them, they were always eating food, and they were always drinking Starbucks.
Yeah, Starbucks has always been involved somehow. Yeah.
Starbucks.
I don't know how many trips to Starbucks they did this time, but yeah,
I have no idea. Yeah, I mean, even the very first day that you were here, Angelina, we had to go to a super Target after going to Costco so she could get a Starbucks.
Yeah.
So yeah, you got discharged on the 27th. That was a Wednesday, right?
Yeah, Wednesday.
And then Friday, the 29th, I drove you back down to the first time I got to go to Dr. Donoway's office, which was the first time you got to go also. And that was for your JP drain removal. We got the drain out that day. And
that wasn't very pleasant.
No, but you did a great job. And and he went over a little bit of the lab work at that time to let us know that those lesions that they had found on your liver, they were similar to the same type, or they were of the same type of the pancreatic tumor. So that was good to know.
That was expected.
And since a lot of his patients, you know, they go home right after the surgery. They don't always even get to see him for the JP drain removal, you were telling me. And some of them never see him really post-operatively at all, right?
Well, yeah. I mean, it all depends on like what the schedule is, but like because I was staying here for much longer,
right?
I got to see him twice, actually 3 times after the operation. If you include the time he saw me in the hospital, which I don't even recall, but anyway.
Yeah, those were good drugs, weren't they?
Yeah.
There's a lot of conversation that you and I had as they were.
I don't remember any of it. No, I don't remember any of it. I remember seeing him for the drain removal, and then the last time the following week, I forgot which day that was, that we went back again. But yeah.
So that was on the 3rd that we went back. So yeah, we had your drain removal out that Friday. I said 26th, 29th of March. Then we went to the Boca Mall again because I had to show you off to some of the people that had talked to you that you can get to see. So you got to see Liz at the Tory Burch store. Not that time, but the next time we went back, like you said. And a couple other people. You got to meet the artists, remember? The really good artists and stuff like that. And we kind of much laid low after that because, you know, like you said, the surgery was a lot on your body. The travel here was a lot on your body too. But we still did a lot of things. I think you and Michael, one of those days afterwards, y'all went to the outlet malls in Palm Beach Gardens and went shopping. And then was it the following Tuesday? I think that was April the 2nd. You guys went to down to Key Largo briefly, drove down there and kind of looked at the water and grabbed a few pictures, and another Starbucks trip for the duo, Michael and Angelina. And then you and I, a couple of days after that, because like you said, then the 3rd is when you went back and saw Dr. Donoway again. That was on Wednesday, April the 3rd. And you got to have an extra appointment with him, which was great because you got to talk to him more in depth about what he thought your next steps need to be. And I think we should talk about that a little bit if you don't mind. And then the next day, you and I went to Juno Beach, just the two of us, and got to do all the fun stuff, walking in the shells and taking lots of good photos and walking the pier and talking to some other people that we met there. And then before you knew it, you know, we had that last little jaunt at one of the preserved areas here, taking some photos. And then we were back down to Miami Airport on the 8th. So you guys could fly back home for sure. So that's kind of the whirlwind of your trip here. Do you want to tell them a little bit about what Dr. Donoway has suggested for you, or how you're feeling at this point? What would you like to discuss?
Well, I think the next step is to go back on chemo, but after talking to him today, what his recommendation is to do a low dose, like not a high dose chemo, because basically we're not trying to attack the tumor anymore, because that's been dealt with. All we're trying to do is deal with the microscopic cancer cell that might still be lurking around.
Correct.
So his advice is to do low dose chemo now. So this is something I'm gonna discuss with the oncologist tomorrow. I was quite happy to hear that, because going back on the high dose chemo, that wasn't exactly something I was looking forward to.
No, of course not.
No.
Yeah, like you said, this is more of an extra checking the box, I call it, a preventative things. Like you said, we've already gone this far. You've already gone this far. You did the high dose chemo, which did shrink the tumor some initially,
Yeah.
And then he was able to do this great surgery for you. We're very thankful that they did not do the Whipple, because you were able to do the surgery,
Why not? Because once you do the Whipple, you can't do the nanoknife anymore, because you got no tumor to play with.
Correct.
Because you need to have the tumor for it to be able to act as a vaccine. You know? So if it's gone, it's not going to work.
Yeah, that's the thing that I think that going forward, I'm really excited for you to do a lot more education pieces on this, because as you well know, and you've had so many discussions, and so have I, there's just not enough people that survive pancreatic cancer.
No, that's true. Yeah. And the Whipple is actually not really helping them to survive either.
No, yet it's still the gold standard.
It seems that with the Whipple, you're almost guaranteed to have a recurrence, and that recurrence seems to be like a lot more, a lot stronger than whatever you had before.
Yeah.
So, I mean, and then you are left also with a totally depleted GI tract that's missing all these organs. And that's missing organs that allow you to absorb nutrients. So, and when you know that most of your immunity comes from your GI tract, that's a bit of a problem, isn't it?
Yes. And that's one thing, you and I have discussed from the very beginning, way before you even got pancreatic cancer, with no family history, no genetic history, no predispositions of any kind. You and I have had many discussions before about, gut health and immune responses, even in the brain gut connection, and all the things that they're finding out. Like the gut's really the second brain. A lot of nutritionists will tell you and all too. So I know that's really been a big focus for you throughout your entire journey, especially since having pancreatic cancer diagnosis.
Yeah, that's right. Yeah. So, and I think this this immunity through your gut, this is really something that gets put aside by chemo and all that, and it's probably a big mistake, actually.
Yeah, I agree.
Because I mean, chemo will just do like a lot of harm to your tract.
Yeah,
it really does. Yeah.
Well, like we said before, it's not selective. It's very necessary.
No.
Because your body is attacking itself at this rate with the cancer type and everything, or any type of cancer. But at the same sense, it's not selective. It's just a broad thing, and I know that's one of the reasons you're very thankful that going forward, this checking the box or one last preventative measure is going to be a low dose chemo. Because there are a lot of people, as you know. Even when I used to work with Dr. Haynes up in South Carolina, we had a lot of patients, that were diagnosed early on with breast cancer at any age. I had some people in their 20s and 30s, all the way up to 70s, and a lot of them, once they got through their chemo, radiation, mastectomies, lumpectomies, all the things, they were still put on a low dose chemo orally for the rest of their life.
Yeah. Well, mine is not going to be an oral chemo, I don't think.
No.
Since it's supposed to be the same as the one I had before.
Right.
But they're just going to have to do that at a fairly low dose.
Correct. And I think he said not very many sessions either initially. Then it'll be your oncologist decision, of course, when you guys meet.
They are the two of them are gonna discuss that at how to best deal with it. But Dr. Donoway said definitely low dose chemo. Not the full strength thing, because that would just be totally unnecessary. Really.
Yeah, it'd be kind of like overkill, honestly. It'd be much. It'd be depleting your system again, and you've been working so hard on nourishing your body at so many levels, too.
No, I don't. I do not want to do that. I think it's been through enough already. So
yeah. Well, like I said, you think about this, and your diagnosis was really August of last year, of 23, and here we are in April, right? So that hasn't been very long at all.
No, and then you think about it, that's already been like technically 3 surgeries.
Yeah.
So, it has been. Yeah.
Plus the chemo, if you're thinking that too. And then your body going through so much in such a short period of time. Plus the fact that, you had to travel quite a distance to get here. That's a lot on your body as a whole. So I think that's one of the things that, not everybody might have the same effects that you're feeling right now of fatigue overall. Like I said, you're feeling a little more run down. But your body went through a lot just to get here and to get home.
Yeah, that's right. Yeah,
for sure.
Still got work to do.
Yeah. Well, you're lining everything up correctly, though. I mean, I'm still in awe of you, my friend. I really am.
Yeah, still got more to go through, though.
I know, but I think the biggest hurdles are behind you. Don't you agree?
Well, I hope so. Who knows?
There's a French in you coming out. I hope so. I'm not going to admit to it, Candace. I'm not going to.
No, because you don't want to jinx it either.
I know.
And I still gotta, in 3 months' time, I still gotta do the blood test, the PET scan to see what's going on.
Right.
Dr. Donoway said that it would be a complete waste of time to do something now, because it's probably gonna light up everywhere because of inflammation.
Right. Exactly.
So it would not tell you, what's really going on. So he said to do a PET scan after 3 months after surgery. That's his advice.
That is maybe chuckle a minute, because that just reminds me of the conversation we had with Laura at the mall that time, about inflammation and lighting up the PET scan,
Yeah.
So I'm excited to see what her 90-day re-scan will look like for her too, now that she's followed more of the nutritional protocol that you did and made some other changes for herself too. Because she's further out than you are, of course, from her initial diagnosis and treatments. But all her lab levels look great. Her CT looks great. Her MRI looks great. Her levels look good. On her labs, it was just that PET scan that was having the axilla and groin, back and forth areas of lighting up, like you said.
Most likely
kind of validates that.
Yeah, it was just inflammation, I'm convinced, for her,
Yeah.
Since it wasn't being picked up.
Dr. Donoway just said for you, even it's kind of silly for even to do those tests, because it would light up right now because you do have inflammation going on.
Yeah. And if you do those tests and then they light up, that only just adds more stress.
Yeah.
So it's kind of a bit of a waste of time. Actually, it's counterproductive. Really.
Oh yeah, because we know that stress again can add another layer of inflammation, because it's going to spike cortisol level.
Yeah, that's right. So
right. And then whenever you have stress, a lot of people don't sleep well, and sleep again is that whole cycle of more inflammation in the body. Your body's not doing rest and repair, and all the things that we always like to try to address and help people out with. So. Anything else that we should update people on? I know that everyone's been kind of eager to hear things are going. We told them a little bit here in posts and stuff back and forth, but not a lot since you've been back home. I'm assuming the kids are great, dog's great, everything else is good. You guys are just getting colder there, and I'm getting warmer here.
The dog is with me in my bedroom here. He's lying down on my bed. See, like my bed is up here, right? And the dog is like somewhere behind there, taking the whole bed, taking the whole king size bed,
Yeah, yours is a little bigger than mine too.
Mine is huge. Yeah, he'll have your two for breakfast. You know.
Well, thankfully he's not that aggressive.
No. He doesn't like to eat little dogs. No.
Not that we know of.
No, only rabbits and ducks. That's it.
There you go. Yeah. Well, Violet still
Yeah.
likes to chase the ducks, so that's true. Yeah.
Mm.
So no, I think everything else is, right on target. Like I said, I know that you would like to be zipping around a little bit faster than you are, but if you really put things in perspective, you're doing quite well, very well.
Yeah, I just have to be a bit more patient, which is
Yeah.
not one of my main traits, but
maybe this is your lesson to learn, darling. You got to learn to work on patience.
I have no choice because I just run out of puff so quickly that I have to stop this. Just it doesn't let me do what I want at the moment. So yeah.
Exactly. Well, This is your body telling you to listen. You don't want your body to scream at you because you're not listening. It will. You know that.
No, that's right.
Yeah, for sure. Anything else that you want to update people on or to say thank you? I know you've had so many people support you through all of this too.
Yeah, they said thank you to all the people that sent prayers or put money on my GoFundMe. Money is still welcome, by the way.
Yes.
I'm far from plugging the hole that the trip to the US has caused. Far from that. So anyone who wants to keep contributing, yeah, by all means, please do it. Yeah. Other than that, yeah. Thanks for everything, especially you and Michael.
Oh, it's my pleasure.
And Dr. Donoway, of course.
Of course. The reason that you got to come finally get to hang out with me. The whole reason.
Yeah, I know, but like without you and Michael, none of this could have happened. So yeah.
Yeah, well, we were just very fortunate to be able to help in any way that we could, and at least we tried to make as much fun of the trip as we could because that wasn't purpose. It wasn't a joyful trip, but we tried to inject as much fun as we could along the way.
No, that was mission accomplished on that. Yeah, that definitely.
Good.
Yeah.
Now I just got to get you moved over here.
Yeah, that's like another mission altogether.
Yeah, we'll call it the 4 to 5 year goal. Is that what it is?
Yeah, something like that. Yeah. Hopefully at some point.
Yeah, depending if Killian agrees or not, your son.
No, yeah, who knows? That's too early to tell on that one.
Right. Yeah.
Yeah.
Well, I know your day's getting going and my day's ending, so I better sign off because you and I could talk forever and ever, but
yeah, I know.
Enjoy our conversations as much as we do. And like I said, maybe in the future we can get some of these people we've been talking about on here too, especially with Dr. Donoway and Dr. Milarski, Lore also. I think that would be really helpful because you're a patient. I'm just a friend. I don't play a doctor on social media, but a lot of people do refer a lot of things to me just because of my knowledge base and the things that I've experienced and worked in over the years. But it's nice when we can have the surgeon and other physicians, and then I was even telling Dr. Donoway, because him and I were messaging a little bit earlier. I said, what you and I talked with him about his practice, I would love for you guys to move forward with this and have even other what we call nanoknife warriors. People who've experienced the procedure and talk about it and where they are now. Because I saw in his little private Facebook group that he has for nanoknife warriors, there's a couple other surgeons and doctors in there too that have gone through this themselves. Because unfortunately, cancer does not select.
Does not discriminate.
Affected by it. Mm-hmm.
Yeah. It. There's a lot of people on his little group and. A lot of people are actually in there just lurking, trying to find out what it's all about. And a lot of them are people who already had the procedure. And I think that most of the people who had the procedure have only been saying good things about it.
For sure.
And quite successful, actually. So
yeah, I mean, especially when you compare the success rates compared to what traditional medicine has been validating as the gold standard for care.
Yeah.
Like we talked about with your diagnosis alone, and like we said, Dr. Donoway of Atlas Oncology, he does other type of cancers too with this procedure, but with the Whipple I think the success rate I was told is around 15%, where with your procedure it's 96.
Yeah, I mean, like with the Whipple, that, like I said, you're almost guaranteed to have a recurrence in the
Yeah.
surgical bed. And then when that happens, well, there's nothing more they can do, pretty much.
Yeah, and plus, like you said, you've gotten so much removed with the Whipple surgery of other organs too that are very vital and
Yeah,
function with immunotherapy of the
yeah.
entire GI tract and just function.
Oh,
Um,
yeah, it's like people have, like people who had the Whipple, they have like gastric issue like forever and ever. Like it's nonstop diarrhea, and it's actually terrible. And
yeah,
they keep on losing weight as well, which is pretty bad, you know.
right. Yeah, yeah, because cancer itself, most people lose a lot of weight going through the chemo and the treatments, and
Yeah,
then sometimes the diagnosis, because of where the cancer is, it can definitely deplete the body in very fast and rapid ways too. So
yeah,
definitely,
yeah. And the Whipple just seems to accelerate all that.
it does. It really does.
And yeah,
Well, that's why I'm hoping that you guys can move forward and kind of have an educational series, between social media and YouTube and things like that to bring more awareness to these other options. I think it's really vital. It's
yeah,
really unfortunate that we're seeing so much more cancer in the world. It's
yeah,
it's really spreading the diagnosis of cancers at all ages now, all different types. We're seeing it on
yeah,
a lot of areas, and of course, you and I have our own theories about why that is. Um,
yeah,
but it's just at least now we know there is an option for some people. Of course, this is not ideal for everyone, but I think at least having the awareness will bring more education and it'll bring more good conversations for people to have with their
mm-hmm,
oncology team, so that they can make the best decision, especially when so many family members are scared. A lot of people are like,
yeah,
mom, dad, sister, brother, just do what's supposed to do, and they hear about their loved ones who have the cancer wanting to do something alternatively, and they get scared, the family members do, because they just think, oh, just do what's normal and let's get through this, where the normal thing is not always the best thing.
yeah. The crazy thing though is that this nanoknife surgery that Dr. Donoway is doing, he's been doing that for 15 years.
I know.
But then people that just do the traditional stuff, they have the audacity to call that experimental.
I
I
know.
mean, come on,
I know. Well,
that like it's totally crazy, like you don't do something for 15 years and still call that experimental. I
no.
mean,
And like
they they
you and I've said though, but he does it out of heart of service because the rate that he barely charges for this is minimal compared
yeah,
to his skill level, and
yeah,
also the fact that he is trying to make more awareness. He's going around the world teaching and educating and speaking on this when he's not in
yeah,
surgery, and he's not a flashy guy. You know what I mean? He's really heart centered, and he's one of the few really really good guys out there trying to make a positive difference. And he went into medicine for a very specific reason, and
yeah,
he's following that Hippocratic oath that we hope all healthcare professionals do. But unfortunately, we know that they do not. And he's not following the money train. He's following what's right for the patient, and that's what's
yeah.
in this world. Yeah.
Yeah, that's correct. And I think all the other surgeons that only do the Whipple and not familiar with nanoknife, they just really scared
Yeah, well,
that
it's they're so used to having to follow suit of what is the gold standard, what's textbooked, what's also covered by insurance.
yeah, true.
So
Yeah,
many things. So fear itself is a whole other topic we can have a conversation about. But it stuns people. It keeps people stuck. It keeps people from
yeah,
moving forward. It keeps people from seeing options. I mean,
yeah,
I have those conversations with people every single day, and the things that I'm working towards personally, to help more people, to make legislation changes, to improve lives, and to
yeah,
help people on whatever it is for their passions and for them being able to follow those, because unfortunately,
yeah,
money makes the world go round. We have to have funds to be able to do things. Like I tell people all
yeah,
the time, you can only pray and volunteer and work so many hours. You have to have funds to
yeah.
be able
That's
to
right.
maneuver
Yeah,
things and make things forward. I mean, that's how you got here. You had to be smart about your finances. And, you know, you've had a lot of really good people step up and try to help with your GoFundMe. And like you said, that's an ongoing thing because those debts are still there, and there's still nutritional stuff that you have to pay for the supplementations and the treatments that you're doing and stuff like that too. So
yeah, that's
a big heartfelt thank you to so many people who've been supporting you, so many people that you met here that keep asking me about you. We went over our 10 minutes again, just so you know, we spoke for 30.
Yeah, that's normal.
But you know, this is a much bigger update because, like you said, we were trying to do this update before you left, but we just had too many things to do. All the food we had to cook and the places we had to go see. So we had to wait till you got home and settled and your luggage back to you, and give you a little bit of time to rest and all too. So yeah, I just really appreciate you, and I can't wait till you come back again. We have a lot of things that we didn't get to go do and see. So next time you get to come over, no surgery, just all the fun stuff, okay?
Yeah, correct. That's the plan.
That's the plan. Let's make sure that happens this time. And we still have somebody that's getting married that we hope that they either choose to get married where I live or where you live, and we'll figure that out hopefully sometime soon too. So then we get to see each other again.
Yeah, that's probably next year though.
I know, but we got to get it in motion. You know, we have to get this in motion. So.
Oh yeah. She knows.
She does know.
Yeah.
But so good to see you. Tell everybody there that I know, say hello, and hopefully we'll have more updates soon. I know you got your oncology appointment tomorrow, and we'll give them an update again, more brief maybe. I don't know. We always talk forever. To let them know how things are going once you get that process started, or when it gets scheduled at least, okay?
Yeah. It's gonna be probably in a couple of weeks, I'd say. Yeah, something like that.
Sounds good. Okay, darling.
Okay.
Good seeing you.
Sign off now.
Thanks.
See
Bye.
ya.